Are you an alcoholic? An addict? Do you have a substance use disorder? Are you sober curious? In recovery? Just trying to drink less? If you felt something when I listed those, maybe you were drawn to one and recoiled from another, that is worth paying attention to. Because like it or not, labels are doing something. They're always doing something. And today I want to look at what that is, why we use them, how they can help, how they can hurt, and maybe most importantly, who gets to decide what you call yourself. So if that interests you, stick around. Welcome back. My name is Jennifer. I'm a mother of 4 in recovery from alcohol addiction. I'm not a doctor, a counselor, or an expert, just a fellow traveler on the path, sharing things I've learned along the way. Maybe something that's been helpful for me will be helpful for you too. So let's talk about labels. The thing about human brains is they are pattern recognition machines. We are wired to sort, simplify, organize, categorize. Because a brain that had to approach every single thing as a completely new experience would be absolutely exhausted. So we use schemas. A schema is basically a mental shortcut. It's a little folder in your brain that says, I've been here before, I've seen this before, I know what this is, file it here. So labels in addiction and recovery are schemas. Alcoholic is a schema. Addict is a schema. In recovery is a schema. They're a way of saying, here is a complex set of experiences and behaviors. Let me give that a name so we can talk about it, think about it, and relate to it. And that's not a bad thing. That's just how we make meaning. The question is, does this shortcut help or does it cut corners that matter? Labels can be genuinely helpful. For a lot of people, getting a diagnosis or finding a word that fits is the first time they've felt understood. This experience has a name. Other people have experienced it. I'm not alone. And that can be enormously relieving. Labels also give us access to community. So saying I'm an alcoholic in an AA meeting opens the door to relationship and community belonging. And the community and belonging is genuinely life-saving for some people. They can give us a framework for understanding our own experience. They help us communicate with doctors and treatment providers. And they can reduce self-blame. If what I have is a disorder, not a moral failure, then I can stop hating myself and start getting help. So yes, labels can help. And for a lot of people, they have. And then there's the other side, because labels don't exist in a vacuum. They exist in a culture. And our culture has a lot of big feelings about addiction. Many of them are not kind. The word alcoholic carries a lot of weight that has nothing to do with your actual lived experience. It carries decades of stigma, images of what an alcoholic is supposed to look like, and assumptions about choices, willpower, and character. And when a label comes on loaded like that, taking it on isn't neutral. It's also important to consider its potential effect on our self-worth. Identity is powerful, and we become what we call ourselves. Some people will find that I am an alcoholic gives them clarity and accountability. Others will find that it becomes like a ceiling, a permanent definition, something that makes it hard to imagine becoming someone different. If the label comes to mean this is what I am and what I will always be, rather than this is what I've been struggling with, that is a meaningful difference. And then there's the diagnostic question. The DSM-5, which is the clinical manual for diagnosing mental health and substance use conditions and disorders, doesn't use the word alcoholic at all. It uses alcohol use disorder, and it rates it on a spectrum, mild, moderate, severe. Because the reality of problematic alcohol use, and really problematic behavior of any kind, doesn't fit neatly into a box. So yeah, a label can open a door, but it can also close a door. It can provide clarity and community, but it can also feel permanent and like something that sets us apart from the community in a way that can be isolating. I'll tell you where I landed on this personally. My first exposure to a recovery support group was Smart Recovery. And in Smart Recovery, they don't use labels. They don't encourage the use of labels. They don't condemn the use of labels, but they do lean on the side of the labels being unnecessary and potentially harmful to one's sense of self-worth. There is no, hi, I'm Jennifer, I'm an alcoholic, which I'm really glad for. I do remember my very first meeting when I was going in there, not really sure if it was where I should be and being really confused about my issue and what it was called or what to do with it. And when it came my turn to check in, I said, hi, I'm Jennifer, and I guess I'm an alcoholic. And the person next to me said, you don't actually have to say that. But two things that happened there, having said that out loud for the very first time, did spark a bit of recognition in me, but it wasn't a necessary part of the process. And in that situation, it's not part of the process at all. I hope that makes sense. And I think maybe the tricky nuance there is that some may feel that that implies denial, not using the label as some kind of denial. But there was a spark in my brain. In using that label, my brain was recognizing some shortcuts, and maybe saying it out loud was solidifying all the things that I had already known for a long time. But so did sitting in that meeting and hearing everyone else check in and say things that were so familiar to me, and just the general realization that I was in the right place to get the support I needed. So yeah, those two different things happened. I did say that word out loud, and then I was quite relieved that I didn't have to. I had this fear like, if I say it now and these people accept it, then now I have to go around forever telling people that that's what I am, that permanent sense of, I guess I'm that, it can feel like a life sentence. So in that setting, I did find the language of substance use disorder and unhealthy drinking patterns and unhealthy behavior and addictive behavior. That language described what I was experiencing without also telling me who I was. And for me, that distinction really mattered. And of course, I'm not saying that's the right choice for everyone. I know many people for whom the word alcoholic is the most grounding, freeing thing to say out loud. And I've said it before and I'll say it again. I'm not here to argue with what works for people. I'm just here to offer other perspectives, other possible paths, other possible outcomes. And I really just want people to know that there are options and that there isn't just this one singular understood way of doing things and this one singular label for having a problem with drinking or with drugs. So yeah, we get to choose the language that fits our experience, and definitely not one that someone else has chosen for us. I have had it come back to me sometimes that someone outside of recovery circles has described me as an alcoholic in conversation. And I can understand the use of that schema, that label, that shortcut. But still, it kind of stings because I never called myself an alcoholic to you. I've talked to you about my experiences and my struggles. And that label is so deeply ingrained in our culture that it just becomes automatic for people. So something like that may happen in your own journey, and you may choose to correct it for people. You may choose to pick your battles and not correct it. Again, all of this is so individual, and the more of us that share our experiences, the more of us can feel seen and heard and have people to maybe rely on and talk to and take a tip here and there from. So where does that leave us? Labels are human. They're how we make sense of things. In addiction and recovery, they can be a lifeline or a limit, depending on the person, the label, and the context. What I'd encourage you to do is to get a sense of your own reaction to the words. If there's one that feels true, if there's one that feels like it fits, or if there are some that make you want to hide in a corner in the fetal position, it's okay to just be curious about that feeling and look more into what it is that's causing you to ask yourself those questions or to have those reactions to those kind of words, because our reactions to things really can tell us a whole lot. And we are allowed to use whatever language serves our healing, even if it doesn't match what someone else thinks is the best choice for us. You are not required to take on a label in order to take your experience seriously. And you're not required to reject one in order to maintain your sense of self. So that's all I've got to say for today. As always, drop a comment to keep the conversation going. The more we can talk about these things, the less power we're giving to stigma and fear. Stigma around addiction is serious and it can cost people their lives. So I think this conversation is very much worth having. Yeah, thanks for being here. Please like and subscribe if this is useful to you. For more information, you can check out the links in my bio or in my description. Until next time, take care of yourself and I'll see you soon.